7:24 now. You know, a new study's been out about 9/11, the first responders, and it finds folks that were there that day and the many days afterwards as part of the recovery are at a real risk of getting cancer. The study was done by a chief medical officer in New York City, and he says the toxic chemicals from the World Trade Center rubble is to blame for these causes of cancer. To talk to us more about it is Dr. David Katz with Yale University. I know there's been a lot of debate. Is there a direct link? And you said there really shouldn't be debate.
Yeah, we were just discussing that, Erin. There should be no debate. You know, the total population of responders to 9/11 immediately and in the days that followed, it's about 100,000 people. And frankly,
that's a lot of people.
Yeah, there's already a lot of illness, particularly respiratory illness among that group. There's going to be more, and we'll talk about that in a second. But I think we should just take care of whatever happens to this group and not split hairs about is it due to exposure at ground zero or is it not. A lot of it will be, some of it won't be, but these people took care of us. We should take care of them. So I'm really sorry to see that there is any debate about cause and effect. We don't have to be absolutely sure to do the right thing in this situation.
That's a message for Congress. Just changing gears a little bit. When we see the video, it seems so obvious now that there would be a connection, that there would be adverse health effects. So as we look to the future,
right,
as medical professionals, what have we learned from that event and what to expect, God forbid, if something like, or even an earthquake or something, has it changed how we respond?
Well, I hope it hasn't changed how the first responders handle a situation. You know, I mean, these really are heroic people who rush in to the very thing that any person of average courage would flee from. I mean, it's amazing. And I would like to think that even knowing about all the health effects that might follow, we have heroes among us who would do that. But they deserve for us to do the right thing afterwards. And as a preventive medicine doctor, you know, we're taught to think about vulnerability. Today's a day, it's an anniversary, it's a day of reflection and looking back. But as we look ahead, unfortunately, we have to recognize that time does not heal all wounds. Wounds to our genetic material, our chromosomes, actually take a long time to translate into cancers. And although I hate to say it, there will be more illness, particularly cancer, due to the exposure at ground zero that we haven't yet seen. We're 10 years out, but at 20 years out, we'll still be seeing illness due to that exposure. We need to expect that, we need to prepare for it, and we certainly need to do the right thing and take care of the population of people who took care of us.
And you were saying this isn't for folks, the real folks who were directly affected. If you wanted to take your children to visit ground zero now,
well, certainly, it's absolutely, Erin, it's a very good point. Certainly now it's fine, all of the toxins have fully dissipated, but even at the time, a little bit of distance is an enormous amount of protection from energy fields and particulate matter. Even the people living in lower Manhattan who are a short distance away, nothing like the exposure of people who are literally, you know, up to their eyeballs in the debris. So this really is among the responder group. I know you spent some time there reporting on it, but even your exposure is trivial compared to those who were rifling through the debris.
And they were there for days.
They were there for days. They were literally on the debris pile, digging into it. Totally different. So that's the group where we're seeing a significant burden of illness. That's the group, unfortunately, where we will see more illness in the future. That's the group we need to be looking out for because they looked out for us.
All right, Dr. Katz, thanks so much. Putting into perspective that even though many of the firefighters who responded that day may have finished up their jobs, they're certainly...
The story's not over.
And the story is not over. They're feeling the lasting effects. So, again, another way to pay tribute is to think about what they really put at risk. For more information,